In the 1990s, the Center for Disease Control in Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 leading causes of death in the U.S., and by some estimates, is responsible for 50% of healthcare costs in the U.S. It occurs in every type of community, from small towns and rural villages to big cities and upscale suburbs. It affects our brain development, immune systems, our hormone systems, and even the way our DNA is read and transcribed. This exposure is not a pesticide or chemical, not a pathogen or pollutant. It's chronic childhood trauma. Adverse childhood experiences leave our children susceptible to poor health and unable to learn, and our adults unable to interact, work, and function socially. But there is a way forward, and the path starts here.
What we've learned from the ACE study is the significant impact that adverse childhood experiences has on society. You'll see things going on with adverse experience, but no other state's taking it on the way we are. But we also should realize that it's not going to be a cookie cutter. It's not going to be one solution fits all. We know that in Michigan. We know what works in the Upper Peninsula doesn't work in Lower Michigan, etc. So we need to learn from those successful ones, create that playbook, and move forward.
So when we look at communities that are working on becoming resilient or in healing in some ways, first of all, it's a relationship-based process. And the first step in any relationship is understanding. And if we can come into that understanding of our own healing journey or others' healing journey from a compassionate perspective, that's where we start. Then the next piece is communicating, creating an environment where people feel safe to communicate, and where people feel invited to be at the table in some of these opportunities for communities to build new solutions and to feel as if their wisdom and life experience matters and they can be part of those communications. And then thirdly, this idea of collaboration, that, together our ideas are far more than any one of us could even dream. There is no quick fix on building resilience and building healing communities. It is a lifelong journey for all of us, and hopefully for our children, as we continue to move this information along generationally and we change how we parent and how we practice. We need to set realistic goals to understand that this is a process and that resilience is not about just bouncing back, it's about bouncing forward.
For me, the definition of resilience is something that gets compressed and then has the ability to bounce forward, to assume perhaps the same shape or a different shape, but something that allows it to move in a positive direction. When people learn about ACEs, they're allowed for the very first time to have an evidence-based explanation for what they know about themselves. It allows them to say, I can understand this, I'm not the only one. So when a person learns that this is science, they have this whole new level of understanding and, frankly, forgiveness of themselves. We know from the ACEs study that when this happens in communities, the interest of a single caring and competent adult can make all the difference in the world. And any of us can be that person, whether that's coaching or teaching or being a good neighbor, it doesn't really matter, or a good employer. We can all provide that kind of relief from an ACEs problem.
Before I learned anything about trauma experiences, I just used to think that I didn't have much going for me. I never really knew what a healthy environment was, so I never thought of myself being able to actually become something that could be pretty awesome.
Parts of who I am are a product of how I was raised and how I grew up, but that's not permanent. And I don't have to be this way forever. And just because these correlations you see, these shorter lifespans, these addiction problems, they're not definite. And I learned that about it. They're not definite. And the only reason that they're laid out plainly like that is for people to see, well, hey, what can we do to combat this? And that includes people who are ACEs, people like me.
Understanding ACEs has made a huge difference in my life because I see what I can be now rather than what I couldn't. Any type of experiences that a person has gone through, you can just put it in the past and you can keep moving forward. And I know that's possible. I know that I've done it, and I know people around me have done it. So I know that everybody can do it.
Learning about the ACE study was the single biggest aha moment of my career and professional life because it connected all of the dots for me. There were so many cases, so many patients, so many encounters that I had that just didn't seem to make sense. When I read this study and saw those very graphic stepwise models that look at your ACE score and then what the implications of those ACE scores can mean, it all made sense. And it just absolutely changed everything that I did and how I did it. The way that we treat children matters. The way that we interact with the people in the world around us and the things that we say and expose them to, they matter. And even if it's pre-verbal and pre-memory, it stays in the body.
An incredibly valuable part of this transformation is that in community, this work breaks down the silos that separate various agencies, providers, institutions in communities. And they work together to collaborate because now we've got a common language. Now we are all working from the same playbook.
As master trainers, one of our big responsibilities is not just to go out and do all these presentations and to share this information, but to really become a catalyst, working together within the communities that we live and within other communities and maybe which we're working, to bring the information in a collaborative way forward.
We're in Roscommon County, and that's part of the ISD, which covers approximately 2,400 square miles. There are 2 school districts, Roscommon Area Public Schools and Houghton Light Community Schools. So as we started some of this collaboration and coordination of efforts, we invited each district and their leadership, put in place a structure for meetings, because we see our school systems being that community anchor to help build stronger, healthier students. I think it's been really the strength of each respective school district connecting with those outside agencies and, again, building trust to work together and build resilience. And that's where I'd say we're stronger together than we are apart. The school really has become that safe place for our students as well as the families.
The Children's Assessment Center is an agency that provides services to abused and neglected children. We're giving them a voice and getting them the help that they need. And if we can continue that initiative as a community, I think 10 years down the road from now, we're going to see these kids being able to be more successful because they're going to learn the skills that they need to be able to get through their trauma. If we really want to make a difference in a community, it's going to take that collaboration with our schools, our medical, our mental health professionals, our churches, everybody keeping an eye out on our kids.
Building a healing community, as I've observed, really comes from the inside out. And so as we're sharing this new knowledge about adversity, whether that's adverse childhood experiences, which are all based on relationships and interactions between children and adults, or whether that's the community itself.
The city of Flint has had a lot of challenges over the years that I think everyone in our nation is very well aware of. But there's a lot of organizations in Flint that are doing what they can to help develop a more resilient community. Our focus here at the Crim Foundation is mostly youth, but we understand that without the presence of supportive, caring, nurturing adults in their lives, that the programming isn't going to work for the kids. One of the things that we do is help schools develop mindfulness rooms or help a teacher maybe develop a mindfulness space within their classroom. And it's a space that a child can self-refer when they just need a brain break or a timeout. So it's helping teachers and students recognize when their stress levels are escalating. We have community school directors housed in each school, and they act as a bridge between the CRIM programming and the school as a community center. So with the community school directors and the community school initiative, we bring mindfulness programming, the nutrition programming, the physical activity programs into the school. And the community school directors have been very active in getting ACEs training to their partners as well.
My first time hearing about mindfulness did come from CRIM. When I heard about it, I knew for sure that I wanted that in our building here at Doyle Ryder. It has helped our discipline. Instead of sending a kid home after going back and forth with the teacher or having struggled with another student, now students are saying, I need a mindfulness break. And what a difference that has made for our school. It changes how you deal with the scholar. Instead of saying to a scholar, what's wrong with you? It's, tell me how I can help you. Tell me what I can do to calm you. Tell me what I can do to make your situation better. When you realize the mindset of a scholar who's dealing with poverty issues or they're dealing with broken home issues, when you have that and you're mindful of it, you're able to help them more. The CRIM Foundation is partnering with us to ensure that we can teach our children, we can motivate our children and inspire them to be the next generation of professionals.
When we talk about breaking down barriers, we talk about the things that keep people stuck. And those things that keep people stuck are poverty, not being able to take care of their children, and not having the right information to get to the next level in life. The church is literally like a hospital. There's therapists, there's counselors, there's ministers, there's pastors, and all of these people have strong emphasis on people's lives. And when they come to deal with different things, they help them to be able to understand why they may be doing the things that they're doing or why their children are doing the things that they're doing. So if you know who you are, if you know what it is that you need to do to get unstuck, then the barrier is then broken.
As individuals and families and leaders in communities begin to internalize what does this information mean, then there's this transformation that happens. And the way that these individuals and community members decide to put that knowledge into play to build that healing community may look very different from one community to another because it draws upon the strengths within each community.
Kalamazoo has pretty vast organizations that are connected with the healthcare, with community mental health, our law enforcement, general organizations that people are involved in, and we're bringing all together. If somebody's involved in the court system, chances are they're also involved with community mental health. They may also be involved with healthcare issues. And when we're getting as many partners together as we possibly can, we're going to focus on the right things. We're going to focus on how to heal trauma, not just for that person, but what has happened in the community that we could maybe affect for the next generation and change how some things are healing. About 85% of people currently are incarcerated for substance abuse related reasons. They're going to be facing, judges, they're going to be dealing with prosecuting attorneys, probation officers. Being able to connect all of those together and understanding that it's not what they did, but what happened to them is a really important part of helping somebody to the future.
As a police officer, I've been with my sheriff's department for 20 years, seeing the same families come through the revolving door. And so I just kept asking myself, how is this? There's all these great, wonderful resources out there. Are we targeting where we need to target? I think when I became ACE aware, it put the big picture together for me. You know that people are going through things, but you don't know exactly what or how it affects them. You have to care. You have to have some empathy in you to want to know. And then having a little bit more compassion and understanding that there's something going on that has caused this. I do think that courts need to look more through, the ACE initiative and start looking at some things that they could do that are more preventative than more reactive. I think we will get a better outcome and maybe not that revolving door.
No matter how far down you've gone, there is a way out, and that's what I try to bring to the court system, is an understanding of all these people that are in front of the judges and the probation officers have a past. And if the more we understand about their past, our past, the better we can treat them, help them, and prevent them from keep coming through this revolving door.
There really is no one-size-fits-all approach to building a healing community. Where I live, we are fortunate to have the beautiful strengths of nature and available outdoor spaces. So how do we build on that strength? In other communities, they're rich with other kinds of resources, whether that's cultural resources or local resources, and oftentimes that's where the strengths begin to come into play as communities rethink what they can be, not just to most people in the community, to all who live in that community.
In Wayne County, or just the city of Detroit, we have a really diverse population. We have 33 traditional districts. We have 100 public school academies that operate largely as their own district, and about 272,000 students that we service. In order to build capacity to reach all of the people that we need to reach in Wayne County, we can't accomplish that with a couple of master trainers at the county level. With regard to the Michigan ACE initiative, we are offering next year a 4-part leadership series, which is going to break down the NEAR content and some additional content that we've added specific to the education system. So we're doing a leadership series, we're doing early childhood series, we are doing some workshop series with some of our MAC trainers. But I think one of the biggest things that we've threaded through all of those different approaches is a requirement that people first look at themselves, that they do some reflecting about what their own experiences have been, and get comfortable with this idea of ACEs and with this idea of building resilience as a natural buffer to ACEs. We hope that through that process that builds empathy, that helps to create what's necessary in order to connect with not just our kids, but with our families.
We have a whole lot more players than other parts of the state. We're dealing with multiple healthcare systems, not just one. And so one good way of approaching it is by actually reaching out to those future pediatricians and family practice doctors and internal medicine doctors, because many of them will stay in the area and then hopefully build up the momentum within whatever community they land in to spread the word. We've applied for some grant funding that will allow us to put together a learning collaborative. We've reached out to all of the pediatric residency programs in Southeast Michigan, as well as one of the family practice residency programs. And we'll start out by learning everything we can about what is known currently about adverse childhood experiences screening and what to do next. We're really cautiously optimistic that we'll be able to write a playbook of how this can be taught to future residents, not just here in Southeast Michigan, but in Michigan as a whole, and quite frankly, nationally. And I think a lot of folks are waiting for that kind of information.
I think success depends on connectivity. At the local level and between communities. We're going to see success happen all across the state at different times, at different levels. So we need to share those results. So that's a communication we need to deal with. But also within each community as they try to deal with efforts, there are faith-based, nonprofit, education, correctional, public health, all efforts that are underway doing their best. They need to talk to each other and work with our Michigan Initiative trainers, master trainers, and others to create this successful venture.
It's going to take time, but I think we can heal. And I think it's an important part of our changing society that we need to look at.
It turned my entire life around. I met a lot of amazing people that helped me grow and do things that I didn't think I was capable of.
Who would we be if we didn't acknowledge the intergenerational transmission of ACEs? Who would we be if we allowed children to inherit their grandparents' stress and do nothing about it?
you betcha it's given me hope. Hope with a capital H. I can't change what happened to me, but I can change where I go from here.
Being aware of what ACEs are and how I am affected by that just prepares me to deal with the difficult things. ACEs are real and they change people's lives.